Hello and good afternoon once again. Ask the gynecologist Dr Alalade here, and tonight I'll be broadcasting and talking from the living room today. I'm hoping my audio is very clear, so if you can hear me, give me some thumbs up, and if you can't hear me, let me know. I'm using this my obvious whiteboard to explain some concepts to us regarding what I posted yesterday about closed cervix, that it can cause infertility and that cervix normally opens during labor. So I'll be talking about this topic today, and I'm going to explain myself so that you understand what it is. Definitely, people might have had misconceptions about what this cervix is, and it's probably causing confusion. So the purpose today is to get this clarified, and so that we understand what I mean and what a closed cervix is. First of all, most people might not understand what the cervix is. Probably I'll need to explain that. See, if you imagine the womb as or looks like a balloon, so this is what you get from the balloon, and this is how I explain all the time. So this is your womb, okay? Obviously, the tubes enters there into the womb. Okay, so that is your womb. Lovely. Where everybody lived in before we came to this world. Beautiful. Okay. So that is the womb. I don't know if you can see me clearly on Instagram, so I'm going to tilt the camera on Instagram. People can see me clearly on Facebook. I'll tilt the camera on Facebook a bit so you can see everything clearly. So that is the womb. The womb is like a balloon, and that balloon has always got a neck. Okay, that is the neck of the balloon. Okay, imagine that you blow air into the balloon. If you don't seal off or close the neck of that balloon, air will seep out quickly and the balloon will deflate very, very quickly. Okay, the same thing too with the womb. The womb is a big balloon. So once the womb is not yet in labor, the cervix is normally closed. Okay, if your cervix is weak, we call that incompetent cervix. Weak cervix is incompetent. Weak cervix is called incompetent cervix, and that will lead to early pregnancy loss because the pregnancy will fall through. Now, so ideally, okay, when I say ideally, I mean under normal circumstances, the neck of the womb is supposed to be closed, and the neck of the womb will open when you go into labor. The neck of the womb opens when you go into labor. If the neck of your womb is open before labor, okay, it's abnormal. Okay, it's not right. Okay, so somebody asked a question yesterday. That lady lives in Abuja. In fact, this lady is currently a nurse. She works as a nurse in Abuja, and she said that she's put her finger in her vagina, and at the top of the vagina, she can feel her cervix. She was right, but she now said that she thinks the cervix is closed. That if her cervix is closed, that is possibly the reason why she's not able to get pregnant. So I now replied to the lady, I said, your cervix is supposed to be closed. Your cervix only opens when you are in labor. The cervix, that is the neck of the womb, will open only if you are in labor. The cervix is normally closed, okay? So the lady now asked, okay, so if my cervix is closed, how will sperm be able to navigate into the womb and meet the egg that is released from the ovary? So I now told the lady that, so that is your ovary. That is your ovary, right and left. And the ovary is attached with a ligament which holds it in place, which is attached to the womb there. So now I explained to the lady that the cervix, okay, is closed. Okay, the fact that it's closed does not mean that sperm can't enter. Sperm is microscopic, unseen by the naked eye. Sperm is suspended in your semen. The semen is the pap, that white thing you see when your husband releases or comes into you. The semen is what looks like pap, but the sperm is inside inside the semen, okay? And sperm is microscopic. Sperm cannot be seen by the naked eye. So the sperm is able to navigate and swim into the closed cervix, okay? The only time if your cervix is not patent enough, open enough for sperm to go into is if you have what we call cervical stenosis, okay? And that will have resulted from you having maybe repeated infection in your cervix, repeated DNC, or repeated treatment like hysteroscopy that was done improperly that has caused scar and scar tissue around your cervix, making your cervix to be blocked. In such a case, then we have to dilate the cervix to allow a reasonable opening, to allow sperm to be able to go through or even period to come out. So the next question will be, okay, fine. If my cervix is closed, how come my period is able to come out? Now, if you don't get pregnant, definitely your bleeding, your period will come. How does period flow out when your cervix is closed? You see, the cervix open when your period is about to flow out, the cervix opens slightly to allow your period to flow out, and it will close back again a day or two after your period ends. That is why it's always much easier for doctors to, or nurses or whoever, radiologists, to do HSG shortly after your period is over, because at that time we're usually able to navigate into much easier into your cervix to get into your womb. So under ideal normal circumstances, your cervix is closed. Your cervix is what? Is closed. The cervix is not open. It only opens during your labor. It only opens slightly to allow period to come out. So if you see your cervix open, it's not right. It should be closed. It only opens during labor. Okay, if it opens prematurely before the end of pregnancy, that leads to preterm labor and increases the risk of pregnancy loss. Okay, so your cervix is closed. That is not the reason why you have miscarriages. That is not the reason why you're having infertility. Okay, if you have cervical stenosis, okay, and we're trying to open your cervix because of cervical stenosis, which may have happened from previous surgery, from previous myomectomy, maybe from previous infection, from previous DNC, and your cervix has been damaged or has been closed, okay, because of scar tissue in your cervix. The same way we have scar tissue in the womb from Asherman syndromes, the same way too people can have scar tissue in the cervix too from repeated DNC and repeated operation. If that is the case, what we usually do is to dilate the cervix. How do we diagnose that somebody has cervical stenosis or a closed cervix? Usually, if you go for HSG, we're trying to pass the HSG cannula into your cervix to push in the contrast dye for the HSG, and we're not able to push in that contrast, that cannula to push in the contrast. If it's very difficult, it could be as a result of cervical stenosis. If we try your HSG maybe a day or two after your period has ended and we're still not able to navigate into that, that means that cervix might need to be opened up. Sometimes too, when you're going for your pre-treatment or mock transfer during IVF, we'll try and see if we can navigate into your womb cavity through your cervix. And if we can't, we might suspect that your cervix might be stenosed. In such a case, we try to dilate the cervix few days or few weeks before the mock transfer, before the actual transfer, to ensure that there's no blocked cervix. Blocked cervix can make IVF difficult to conclude, can make IVF difficult to complete. So I was explaining to that lady at that point, and I hope the lady understood what I was trying to say, that our cervix is not a problem. And but the thing is that, you see, I always realize that once people, they've decided that because maybe their friend had cervical stenosis, and because of that, that might be the reason why that person had a miscarriage. People would think they too have such a problem because they are worried, they are anxious. They want to see that they touch everything that is possibly causing their infertility or what could be the culprit of infertility in their case. So they want to do everything. They want to suspect everything they hear. They go to a party, someone is talking about what happened in their own case, how they were managed, and you start to wonder, Could this be me too? Could this be happening in me too? And then you want something to be done for you when you don't even need it. So if you think that your cervix is blocked, just go to a gynecologist, they will examine you, and then they will know if your cervix is blocked or not. If it's not blocked, leave it alone. If it's blocked, then we try to dilate and open any blockage in your cervix. Now let's take some questions here. Now, hello, Ehi Oduwari, Agbo Bita Enyang. Thank you so much, guys. I'm just coming up live too. Sotikare Victoria Ibiemi Wolami, thank you so much. Inebihe Ike Odem, thank you. Jovita Siribe, Emi Ikatwa from Benin, Chidima Anyamu Ojike, and we have Anne Chidima Oji, Chiwendo Zumba Okenwa, additional Oyinlola, wonderful name, and Vivian Diko Briggs, one of our moderators there. And we have Christy Chooks, Obiora, Joy, Chidi, Ogu Diegu, Omoti, Egbelewa. And we also have people watching simultaneously here on Instagram. And there's a question here on Instagram. She's saying that is Morenike, what is the solution to pelvic adhesions in which both tubes are open but there's still infertility? Now, if you have pelvic adhesion, so this pelvic adhesion, for example, so that's your tube, open, 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 okay? That's your tube there, open, 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 okay? But we open into your tummy, maybe doing laparoscopy, and we can see scar tissue everywhere. And your bowel is stuck to part of your womb, part of your ovary is stuck to part of your womb because there's scar tissue and pelvic adhesions. What we need to do is to do laparoscopy and dye test, or HSG. As far as your tubes are not blocked, okay, and we're able to get the contrast dye from down below vagina into your tube to spill into your tummy on either side, okay, on either side, that means the tubes are not blocked. And if the tubes are not blocked, that is not a cause for infertility. As far as the tubes are patent, as far as the tubes are not blocked, then that is not a reason or the cause for infertility. Am I making sense? So that is that. Now, if you have pelvic adhesions and we locate them, we find them doing surgery, doing laparoscopy, then we divide them. We take away and we cut away all those scar tissue in your tummy. We take away those scar tissue. We call it adhesiolysis. Laparoscopy and adhesiolysis. We take away those scar tissue, okay? And if we see any endometriosis, because sometimes too, if you have very, very bad endometriosis in your tummy, you can make it to have pelvic adhesions and scar tissue in your tummy. So if we find all those adhesion, all those scar tissue in your tummy from endometriosis, then we try and take them apart. Very important. Very, very important. So we take them apart, okay? And let's see a question here. On Instagram here, Moshibola Town number 14, she says that can a woman get pregnant with one ovary and one tube? Yes. If you have one ovary, okay, and that ovary is still ovulating, even if you have one tube and that tube is perfectly functional, maybe your tube was removed for some diseases, maybe it was removed for previous ectopic pregnancy, as far as that tube you have that is left behind is still open, is not damaged, is not closed, and you're still ovulating regularly, that tube can still get you pregnant successfully. And I've seen that so many times before. There's a question here on Instagram. Chidi Ebere, she's saying that 23Y, 23X chromosome. What does it mean? It means it's a boy. Whenever you see Y chromosome, that's the boy. Let's go on here to Facebook to some questions here. Okoye Gloria, she's saying that Dr. Ideyo, greetings. Thank you too for watching, Okoye Gloria, wonderful. This is Alalade here. Genevieve Jaja is saying that, thank you, doctor. I wish to ask if there is no medication that can open the cervix. Must they open in the hospital by dilatation? If your cervix is damaged, your cervix is closed, and there's stenosis there because of scar tissue from infection, from previous surgery, your cervix is totally closed, okay? We can open it through hysteroscopy, we can open it through cervical dilatation. Sometimes too, we use some medications called mifepristone to soften the neck of the womb before we try to dilate it open in the theater. So there's no medication that will suddenly open your tubes, open your cervix if it's been stenosed, if it's been damaged, if it's been blocked because of infection, from diseases, from previous surgery. That has to be dilated through hysteroscopy camera. Sometimes we do cervical dilatation for that. Thank you so much. Somebody is saying, can a woman menstruate without ovulation? Very unlikely, but it's possible. A woman can menstruate without ovulation. We've seen it before with people that have polycystic ovarian syndrome. People can menstruate and they don't have ovulation. I've seen that before with people that have polycystic ovarian syndrome. Thank you, Elizabeth Joshua. God bless you so much for being here. Please, can closed cervix cause menstruation seizure? Very possible. If your cervix is stenosed and it's totally blocked, okay, and it's stenosed totally blocked, sometimes menstrual loss will hide above there, and there's a name we call that, okay, pyometria. The blood can cause an infection and cause pyometria infection buildup. Sometimes, very rarely, but it can happen. If your cervix is totally blocked, yeah, it can cause you to have a period, but the bleeding does not come out, and it gets collected in your womb. Can be painful, uncomfortable. So yes, it can happen. And if that's the case, we try and open the cervix through hysteroscopy or through cervical dilatation only. Okay. Good evening. Good evening to you too, Jesse Saint. Krista Chigoze is saying, what is making one to ovulate and not get pregnant? If you're ovulating, your tubes are blocked. If you're ovulating, your husband's sperm count is not good, you're not going to get pregnant, okay? Please, doctor, what is the causes of pain in your groins? It can be from ovarian cyst, it can be from fibroid, it can be from an infection. So you need to get your cervix examined, vaginal swabs done to check for infection. Now, the ATG IVF Center is open last month, June. You all know that. We opened June 1st last month, and we are doing amazing. We started our egg transfer now. If you still want to take that opportunity and get your IVF done this month, next month, August, it's always high time for you to call the IVF Center on Monday morning. It will be open then. Call and say you want to talk to Nike, and she'll go through the IVF prices with you. And in fact, now we've been able to bring down the IVF cost. So don't delay, don't dull. Call Monday morning and get all your IVF cases sorted, get booked. And it's very important that if you cannot even pay the whole fee, it's okay. You can pay half deposit. You can pay 25% deposit. But definitely, by the time you need to start your stimulation, you need to have your full balance, but you can start treatment, appointments, and all the consultation as soon as possible once you put in your slight deposit. So you can also tell Nike, the second lab manager, and she can arrange for instrumental payments for you to get your IVF done at the IVF Center. If you've been trying to get pregnant, you've been trying for more than 3 years, you're not ovulating, your tubes are blocked, husband's sperm count is a problem, you might need IVF, it's high time you call the IVF Center ATG and get looked after and make your dream come true. See, Nigeria now, the forex price is affecting our cost, and everything's going up now in Nigeria. Petrol, everything. But we try and we want to keep our IVF cost stable and not take it up. We don't want to take, so it's better for you now to call now and get booked. And are you paying a deposit? You secure the current price, and your IVF will not be affected by inflation. It will not be affected by price increase. And if you get pregnant before your first appointment for the IVF consultation, we give you your money back, no qualms, no hassles. There's a question here by Busari Zainab Adwola. What is the cause of left bite pain after one sees your period? The pain could last for up to 10 to 14 days. Can this be cause of infertility? Very unlikely. It could be ovarian cyst. It could be endometriosis in the ovaries. So get a scan done to check your ovaries and to check your womb, checking for fibroid, checking for ovarian cyst. And if there's nothing like that, then that pain is not coming from your womb, neither is it coming from your ovary in most cases. Can someone be diagnosed of PCOS after having 2 kids and no signs of it? Yes. You can have 2 kids and then you suddenly develop PCOS. It can happen. I've seen people diagnosed with polycystic ovarian syndrome, PCOS, after they've had 2 normal or 3 normal deliveries, or even 1. Question here on Instagram. Doctor, what drugs can someone use if she's feeling itching in her private part? First things first is what is causing your itching. So we need to know what's causing your itching so we can give you the best treatment. But in most cases, at least before you get examined, use some peritin, but get examined to know what this itching is, what is causing it, where it's coming from, so we can treat you exactly for what you need to sort the itching out. Okay, it's important. Adenomyosis. What are your chances of conceiving? Very, very good. You have adenomyosis, you can still get pregnant. It doesn't stop you from getting pregnant. Thank you so much, Vivian, and all the moderators out there for putting up our links for seminar payment. And by the way, this month of July 21st, we're having a ATG IVF gender selection masterclass. See, at the ATG Center, if you want to do family balancing, that is available to an extent. So we try as much as possible to give you the best options. And we discussed that during the IVF seminar coming up July 31st for gender selection, family balancing masterclass. Okay. Now Agatha Ekene Idu, she's saying, how can I get to Nike to schedule a test? Very easy. Please, Anne Chidima, can you help me, or any of the moderators, can you help me reply Agatha Ekene Idu and give her the laboratory number so that she can call Nike in the morning and she can get all tests done. Now, by the way, if you do all your infertility tests at the ATG IVF Center or our ATG laboratories, I would review them. By doing your test at the ATG Center, by doing all your infertility tests at the ATG laboratory, whether it's FSH, LH, AFH, testosterone, prolactin, I'm obliged to review all your results, and then you know what's happening. So if you do your test, the infertility test at the ATG IVF Center, I'll go through your results free of charge. That is my obligation for you. So get all your tests done at the ATG laboratories or the ATG IVF Center. Call Nikki on Monday and she'll go through the things you need to do with you. LH, FSH, get your ultrasound scan. And in fact, now we've got a 3D, 4D ultrasound machine at the ATG IVF Center, at the ATG laboratories, and you can get your 3D scan done. In fact, even if you're on Clomid and you want to do follicular tracking scan, you can get that done as well at the ATG facility. We also have a new service now, hysteroscopy, where if you need a look into your womb cavity to take biopsy, take out any scar tissue like Asherman syndrome, and so on and so forth, to open your cervix if your cervix is blocked. We have a new hysteroscopy office hysteroscopy machine now, which is very, very no pain, and it can be done without you being asleep. You're going to be awake. It's available now at the ATG IVF Center, and you can get booked for that. That is called hysteroscopy. So get that done as soon as possible. The question here, what is the difference between retroverted cervix and closed cervix? Okay, retroverted uterus, there's nothing called retroverted cervix. There's nothing called retroverted cervix. Okay, but we have what we call retroverted womb or retroverted uterus. Basically, it means that your womb is not tilted to the front as common, it's tilted to the back. It does not cause infertility. It might cause some discomfort during sex, but your retroverted womb tilting to the back does not cause infertility. Now, closed cervix is cervix that is closed. It's closed. Retroverted womb is womb that is, instead of your womb tilted to the front like this, okay, the womb is tilted to the back like this, and it causes pain during sex. Okay, that is just war, but it doesn't cause infertility. Okay, all right, that is retroverted uterus, and that is a closed cervix. Is cervix that is totally closed. Okay, doctor, how do I get rid of severe skin tag on my neck now that you're pregnant? I'll suggest you consider taking it out after pregnancy has been completed. Don't do any operation on skin tag on your neck now that you're pregnant. Wait until baby is born before you now start touching any skin tag on your neck. I beg in the name of God, okay? Your period started on July 3rd, lasted for 4 days. Since then, you've been having bleeding and spotting. What could be the cause? It could be infection, it could be fibroid, it could be cervical polyps, it could be some diseases as well. So ensure you do ultrasound scan, do vaginal examination to check your cervix. Also do pap smear, cervical pap smear to check for any abnormalities on your cervix. Do vaginal swabs and do ultrasound scan so we can look for what is causing this irregular bleeding that you might be having. Okay, now what does RH insensitivity mean? Can it cause infertility? What is the remedy? Resource incompatibility, that's what you're asking. Hello, Michael, you're asking about resource incompatibility. That is when a woman is carrying a resource positive child when she is resource negative, and it can cause miscarriage in the second trimester. You need to be seen by the hematologist to get you treated and get sorted. For that, you need to see the hematologist, okay? If you've carried a baby before for somebody that is rhesus positive, and your baby is rhesus positive, and you are rhesus negative, you need to be seen by the dermatologist to get you sorted before you get pregnant, and even throughout your next pregnancy. Okay, thank you guys for watching me. I really appreciate it. I need to go now. I hope to see you soon, later today or very early tomorrow. God bless you. Have a wonderful weekend as well. Thank you. Bye-bye.